Hello everybody, happy Tuesday and welcome back to our Women's Health Q&A live. Today we're talking about, or this month we've been talking about why we don't go straight to stretching when a woman is sore, and I've highlighted 3 areas so far and I've got 2 more for you today. So if a woman is sore between the shoulder blades, it is not ideal to assume she's tight, and here is why. Women have round rib cages, okay? We have a different shaped rib cage to a man, and we have a different sternal angle, which is this T-shaped bone here. So our sternal angle sits down a bit, whereas a man sits up a lot more. And just look at what happens to my posture. So number one, our postural assessments have to take into account that angle and that shape of the ribs, okay? Now, with that in mind, we've discussed before that women are generally more mobile and less stable than their male counterparts. And I just want to caveat that with a little demonstration with my highlighters. So if the blue highlighter is all men and the yellow highlighter is all women, then when I say women are generally more mobile, all women are not all generally more mobile than all men. Okay, there is this middle ground here where some women will be more mobile, but some women will be less mobile than all men. And if you look at it in terms of muscle mass and strength as well, there's still a spectrum and an overlap. Okay, not all men are stronger than all women. Not all women are more mobile than all men, and not all women are less stable than all men. Okay, there is that overlap there. But generally speaking, with your female clients, you can't go straight to, oh, she's tight, just because that works on your male clients, or we've never thought about the alternatives before. So with the shoulder blades, the shape of our rib cage and our sternal angle, this means it's more, or it's easier for us to bend into this kyphotic posture. And in fact, some kyphosis, not an actual kyphosis, but some rounding and forwarding is more common and more normal for us than it is for a male body, okay? So if she's sore between the shoulder blades, think first about how her ribs are moving. So where she's breathing, you know, has she got a really shallow upward breath? Has she got a downward belly breath? Are her ribs nicely sort of inflating and deflating as she inhales and exhales? Where do her organs go when they're displaced by the filling of her lungs? I don't know. Have a look at her. See what you see, okay? Her head position and her hand position. Is her head aligned over her shoulders, or is there this like pulling on those muscles because of a forward head? Or her hand position, if she doesn't have her thumb facing forwards and she's like this, you can see what happens to my shoulder. And there's stuff happening in my shoulder blade as well when that hand rotates in. So just have a look at it, see what you see. Her mobility and flexibility generally, okay, is she one of those women that is more mobile than all humankind? In which case it would take a lot more effort for her to stay stable, right? And if she's hypermobile, you can almost guarantee that her soreness is either a chronic stretch or a hypermobility like overworked in the stability sense. You don't diagnose any of this. You just look at her body. You do a thorough postural assessment. You have a look at, you try to identify upper and or lower cross syndrome. And then just try to move it back into a more effortless alignment, okay? Now, that's why you don't go straight to stretching the shoulder blades, but because it's the last session, I didn't want to finish this topic without talking about the low back, okay? 99.9999999% of women, especially mums, will have a sore back at some point. And it's not usually repaired or improved or helped by hip flexor stretching. And I know that's a controversial view because a lot of us go straight to hip flexor stretching when we see a lordosis or we have a client that feels low back pain. But in women, low back pain could be pelvic floor dysfunction. Okay, low back pain could be just one of the 14 distinct muscles in the pelvic floor being tight, being long, overstretched, being disabled by nerve damage, or uncoordinated, so not working with the other 14 muscles in the 5 layers of the pelvic floor. Okay, women's pelvises are different shapes. Our pelvic floor has to cover a lot more ground than men, and thereby a lot more gravity and pressure than men's pelvic floors, and so you cannot discount that with low back pain. The only person that can tell you is either your client with her symptoms. Is she leaking when she sneezes? She got bulging sensations in her vulva, or a pelvic health physio, which is my go-to because they literally look on the inside. Single leg stability. So again, in women, the pelvis low back, is it that she's unstable? So I'm going to talk really loud in case you can't hear me. But if we're only testing stability like this, or in 4-point positions, or maybe we're super tricky and we're doing, forward back movement, that's all well and good, but we need to assess balance in 3 dimensions. So for women, forward back, yes, left, right, yes, but also circles, okay? And not necessarily these exact exercises, but they're good indications of her pelvic stability, which is a good indication of her low back health. Diastasis, right? If she's got abdominal separation, or if she has long abs, okay, then she will present with this duck posture, okay? Now, this could be anything. It could be tight erector spinae, could be tight hip flexors, but I want to say the hip flexors, if that's the low back, the hip flexors sort of attach like this. So they can be part of either an anterior tilt or a posterior tilt, right? So you can't assume hip flexor stretch for low back tightness or pain, okay? So when you see this, my thoughts are first short low back, not necessarily tight, short low back, or long abs, or diastasis, okay? Because then you just have the linea alba. If she's had babies, it's probably stretched, or if she's a he and he's morbidly obese, then the abs do separate, and then it's just like tissue, okay? And the abs are contracting over here and the tissue's coming out there. So those are reasons for low back pain, low back shortening that I look at first before, the low back's tight, let's stretch it. Or the low back's tight, let's stretch hip flexors, okay? It's much more logical for a female body to go along the unstable pelvic health hypermobile line than it is to go to it hurts, therefore it's tight. We need to think differently when we are training female clients, and this is just a fundamental way of thinking about movement for women, okay? They are generally more mobile, so if there's a place of pain, it will generally be a stability issue or a hyperstretched issue rather than tight and needs soreness. And so what works for men and what's worked for your male clients probably isn't working for your female ones if you really look at it and you study it and you measure your results. If you have any questions, thank you for listening to me, please feel free to message me and I will attempt to answer them in my next live. Adios.